Thank you everyone for attending our Black Doctors panelists today. I am so happy to be here and I appreciate the fact we have some doctors here in Sonoma County to join us in this conversation. They will be answering some of those tough questions, and then we will also take questions from the Zoom audience, if you will. And so if you have those burning conditions and sentiments of why we should be doing this, this is the time to get those questions answered. So we're going to start off with introductions from our doctors today. So today we have Dr. Ferguson. Would you like to introduce yourself?
Sure. I am Monica Ferguson. I am an internist with Providence, formerly known as St. Joseph Health, here in, excuse me, in Santa Rosa. I moved here from Philadelphia almost 6 years ago now, and I'm very excited and happy to be here and to be able to participate in this panel.
Thank you so much for joining us. Dr. Reed.
Hi, everyone. So my name is Dr. Jamal Reed, allergist immunologist here at Santa Rosa, Kaiser Permanente. And I too have been in the area for about 6 years. I came from Chicago where I studied, lived there for about 10 years. And I'm just excited about doing this and getting the information out there.
Thank you so much for joining us today. Dr. Sanders.
Hello, my name is Aaron Sanders. I am a physician assistant working at Kaiser Permanente, Santa Rosa, specializing in orthopedics. I'm originally from Los Angeles, born and raised in Compton, California, by a single mom and a strong grandmother. I went to high school in Watts, Los Angeles, at Vernon Day High School, college preparatory high school. After graduating from high school, I did graduate from my HBCU, Langston University, in the class of 2000. From there, I obtained my physician assistant studies in Oakland, California, under the tutelage and training of Dr. Watson, who is a stalwart in the Oakland community for years. I've been employed by Kaiser Permanente Santa Rosa for the last 13 years. And this is so exciting to really talk to our community. We have all lost people through COVID, and I feel like this is our duty to really show how important it is to our community. Thank you.
Thank you so much. And Dr. Baldwin.
Hi, Kismet Baldwin. I'm the Deputy Public Health Officer for Sonoma County Public Health Division. I've been working in Sonoma County coming up on a year, so I'm fairly new to the area, and I'm excited about this. I'm really interested to hear the questions and have a real communication and dialogue about what's happening, what we're seeing as far as COVID, and what questions people have about the vaccine.
Okay, thank you so much for that. I welcome you all. I'm super excited. Like I said, this is the first of many that I hope to come forward from this community, especially for those that look like us. They want to hear from us. So we're going to go ahead and dive into questions. But before we do that, we're going to have Dr. Kismet Baldwin present us with some data.
So I'm going to make this as short as possible because we really want to get to the actual dialogue and communications and discussions. But just to give a little background on what's happening and what we've seen in Sonoma County. All right. So this is basically from the start to where we're at, what we've seen countywide trends in our number of new cases per 100,000 residents per day, overall test positivity, hospitalizations due to COVID-19, and the test positivity in our most vulnerable populations in the county. And that's looked at through the lowest Healthy Places Index test positivity. And what you see is we started off pretty low, it really peaked, and now we have come down quite nicely up until this point in time. We have seen a little bump in our cases, however, and so we are monitoring that closely, especially with the reopening of everything and a lot less restrictions in place. So This is, the surges that everyone has spoken about over time. And again, we're in a good place, but we can always get better. When you're looking at cases by racial or ethnic groups and who's been most, disproportionately impacted over the course of the pandemic, we've been able to break that down. And the Latinx population has been most disproportionately impacted, but all of our communities of color really have been impacted. And when you compare them to the white population in the county, and this is where African Americans or our Black population kind of lands in the spectrum. And really the take home points are that the Black African American population has experienced a total of 358 COVID-19 cases during the pandemic. But relative to the population size in Sonoma County, which is pretty small, they're the fourth most disproportionately impacted group in Sonoma County. And so that really means a lot. You can't just look at the numbers. We have to, base it on how many cases we would expect to see for the population size. And so there is clear, information and data that the Black population has been disproportionately impacted in Sonoma County. And this is over the past 60 days. So the previous slide was all throughout the whole pandemic. This is what we're seeing in the last 60 days. And it's concerning because we are seeing an increase in the number of cases in the Black and African American community, or the rate compared to other racial or ethnic groups, pretty much at the top there. And some of our other groups are starting to spike as well. So in the last 60 days, African Americans in Sonoma County have been most disproportionately impacted by COVID-19 cases with respect to population size. So that's saying a lot. And that's another reason why we should have this, happy to have this conversation today about vaccination. So what's contributing to the increased cases? I mean, 87% of all cases in the past 60 days were among individuals who were not fully vaccinated. So they've either not received any doses of the vaccines, or they've only received one, and that's not considered fully vaccinated. So this is why we're seeing an increase in cases. And our COVID-19 rates are highest among, again, the unvaccinated and partially vaccinated individuals in the county. When we're looking at vaccination status by race and ethnicity, if you look at the bar here, we're looking at the Black African American population. Among Black and African American cases, 96% were among individuals who are not fully vaccinated since the vaccine's been available to people. So that says a lot. People who have been vaccinated are doing very well in the African American community, and really not coming down with many cases of COVID after being fully vaccinated. This is overall for the county, the number of residents that are partially and fully vaccinated. And we still have some work to go across the county. There's a good, 25, 26% of the eligible people, which is 12 and above right now, who we still need to get to. This is a busy slide, and I think we can give these slides to whoever who wants them, or this is being recorded and you can look at this later. But the real key take home points are that the Black population is vaccinated at a lower rate than all race and ethnicity groups, except for the Latinx population and multiracial groups. The younger population is vaccinated at a lower rate than the older population. And the majority of new cases over the last 60 days in the Black or African American population are among the younger, unvaccinated population. We do have variants in the county. We are monitoring that closely. That's been in the news quite a bit lately. We update our dashboard, the SoCo Emergency COVID dashboard, with any new variant numbers every Thursday. And so we are seeing a wide range of variants in the county. I think in the news, we're hearing a lot about the Delta variant that is in the county. We are watching that. And we're seeing these variants, and again, cases more in people who are unvaccinated. So the real key takeaways here are that that Black African American population is vaccinated at a lower rate than all race ethnicity groups, except for, again, Latinx and multiracial groups, with the younger population vaccinated at lower rates than the older population. 96% of the COVID-19 cases among Black African Americans are occurring among individuals who are not fully vaccinated. With new variants entering our community, COVID-19 may spread more quickly among the unvaccinated and partially vaccinated populations, and we are seeing that currently. And it's essential to increase vaccination rates to reduce the spread. So that is the end of my presentation, and we can start with the dialogue.
That was a lot to digest. So I just want to remind everyone that if you want to ask a question, feel free to raise your hand or put it in the chat box. And so we're going to go ahead and get started with some of the questions we have. So the first one we're going to tackle is about mammogram, x-rays, CAT scans. What do you say, Dr. Ferguson?
Well, what I can say is a few months ago, we started noticing that women who were going in for their routine screening mammograms, the radiologists were finding enlarged lymph nodes under the arm, where, which is part of what we look at when screening for breast cancer. So they were seeing enlarged lymph nodes in people who had been vaccinated on the same side that they received their COVID-19 vaccine. So as a radiologist, when you see an abnormality like this, you're obligated to pursue it further, which could mean repeating the study. It could mean as much as a biopsy, depending on the size of those lymph nodes. And we realized that it was just part of the body's immune response to the vaccine, was that it was causing these enlarged lymph nodes. So wasn't harmful, wasn't a sign of cancer or anything like that, but to prevent the need for unnecessary testing, a recommendation was issued. My organization, I believe, recommended waiting at least 6 weeks after getting that second vaccine dose before having a routine mammography. I've heard longer intervals, but again, the issue is that these reactive, we call them, lymph nodes can be seen under the arm, depending on which arm the woman received the vaccine. So wait on those. I haven't heard of any issues with other imaging, so CAT scans or anything else. And, other imaging is typically done for further evaluation of a symptom in the first place, whereas the mammogram is just done for screening. So that's the story on that.
Okay, thank you so much for that. So we also have a question regarding G6P deficiency and allergies. So Dr. Reed, we'd like to hear from you in regards to that.
Sure. So I think that this has been on a lot of people's minds ever since the vaccines rolled out. And a lot of that has to do with the publicity around when the Pfizer vaccine first came out. There were 2 cases of possible anaphylaxis, which is a severe allergic reaction in some of the patients. And after this, the recommendations were that a lot of patients that had a history of different types of allergic reactions talk to their doctors and to see if they should get the vaccine. The good news is that we've had a lot of vaccinations since then, and there was a safety report that came out in January of this year that showed that these are very, very rare. So there are about 11 cases in a million for the Pfizer and 2.5 cases out of a million for the Moderna. So it's actually very, very rare to have anaphylaxis. And so knowing that, the recommendations right now are that if you have had anaphylaxis in the past to an injectable, that is something to talk with your doctor about, but usually you can still get the vaccine as long as you have increased monitoring, which just means that you have an increased amount of time that you'll be monitored instead of the 15 minutes. And the only real contraindication, meaning that a doctor would say you shouldn't get it, is if you're allergic to the vaccine itself. So you got the first vaccine and you had an episode of anaphylaxis or symptoms of allergy, or you're allergic to one of the main components. So in the two mRNA vaccines, that would be polyethylene glycol. And in the Johnson & Johnson, that would be polysorbate 80. So if you have a known allergy to those, that's a contraindication. And if you're like a lot of my patients and you're now asking yourself, wait a minute, do I have an allergy to those? I wouldn't worry about it. Polysorbate 80 and other compounds that cross-reactivate are in a lot of things that are in products every day. So if you don't know that you have an allergy, you probably don't have the allergy. And so most patients can get it unless you have that known allergy. In terms of things like G6, PD deficiency, and other issues of autoimmune inflammation, these are not contraindications to get the vaccine at this point. So there is no increase in any of the adverse reactions that's known for the vaccines in this population.
Okay, thank you. And in regards to the Tuskegee experiment and Henrietta Lacks, and we hear a lot from our community about that. So what are your thoughts about that, Dr. Sanders?
Thank you. Well, let's talk about trust. Let's talk about trust. It is well known that in the African American community, we have doubts. Me, myself, I have switched my doctor because I can't connect. Maybe I had trust issues, okay? I come from a historical Black college called Langston University. And when I went to the school at 18, one of my upperclassmen told me about the Tuskegee Airmen experiment, syphilis. And so this experiment was conducted in 1932, in which the government took around 600 African-American males and pretty much ran through an experiment testing the progression of syphilis and trying to find a cure. The problem was there was never an informed consent, okay? And what happened, how they kind of colluded with a lot of doctors and with our patients, our African-American, would say, well, we're treating you for bad blood. We're treating you for anemia. We have a cure for you, okay? Now, this generation was in the 1930s and 1940s. So I'm speaking of people like my grandfather, my great-grandfather, my grandmother. And this has lasted through generations of mistrust, because we all have heard those stories sitting down at our dinner table about the Tuskegee experiment, or I'm sorry, the Tuskegee syphilis experiment. But I say now that the Moderna and the Pfizer, part of their trials were conducted in 4 HBCUs, Morehouse, okay, Howard, Meharry Medical School, and I believe there's one, I forgot, my memory's slipping, but these are prominent medical institutions in our community that serve our Black community. In fact, the Pfizer and Moderna included 10% African-American participants, and that's highly unusual for any vaccines that's been studied throughout history. And I know that we still have to work on trust in our medical world, but I say this, I have had an uncle that had suffered tremendously with polio. My grandmother had 10 kids, and post-World War II, in the 50s, he took my uncle to a beach, and he came down with polio. 3 of her oldest sons came down with polio heavily. He lived his life in a wheelchair, did everything as an able-bodied man, but lived his life in a wheelchair. And from that point, my grandmother took all her kids to get vaccines from that point on. And so we have to rely on facts. We have to rely upon what the numbers tell us. We have to get our prostate checked. We have to get our colon checks. We can't just believe in, I'm good, okay? I have lost men probably in mid-50s in COVID because they just didn't want to go to the hospital when they got sick. And maybe it wasn't through COVID, but it was through diabetes, other compound measures in their past medical history. So I want to say that, yes, this study, Pfizer and Moderna, did include us, okay? So please, let's really ask the question, what is the trust issue? And let's read the facts. And please, cancer, COVID, HIV, it doesn't matter what skin color you have. You know, these diseases will affect you. And the ones who are protected are the ones who's educated, or the ones who really use their access to see their doctors and spread the positive words about that to their family members who still have doubts. This is the main reason I'm participating, because I have my own brother that's a year older in LA, partying up, going to shows, and he's not vaccinated. And so this touched home. And so I think this is really passionate that we really try to break down the trust and really rely on the facts in medicine. Thank you.
Thank you for that. I hear some other health forums coming out of what you just said. So we look forward to having that soon. So one of the major questions is boosters. Will it be needed? Anyone can tackle that.
I can, oh no, go ahead, Dr. Reed.
Okay. So at this point, the short answer is not known, but the long answer is initially they didn't know how long the immune effects would last. And initially you might have heard things like 3 months and things like that. There was a recent paper that showed that you have a response longer than that, and they pushed it out several months. But at this point, they think that you will continue to have immunity for quite a longer time than 3 months. However, the other issue to tackle here is variance. So it has to do with how long the initial immune response is, and if we need alternate immune response for any variants. So at this point, we won't know.
Dr. Bowen, did you have something to add?
No, that sums it up.
We also have, of course, the microchip. Many of us have heard that. So who wants to be the brave soul to tackle that?
I can say I've looked at the, vaccine ingredients, and even though I may not understand all of them, microchip, I've never seen that in there. And as an ingredient of the vaccine, and even in the production of it, there's no evidence. There's no evidence of a microchip being part of the vaccine. So there's no evidence of that. There's no data. There's nothing. There are microchips and a lot of other things we use, like our phones, where they know a lot about you, every day that you're using. But no, there's not a microchip in the vaccine.
Okay, we're going to go ahead and take a question from the QA. With the odds being 1 in 1,000 of a drug being FDA approved and the average time for FDA drug approval being 12 years, how can we find comfort knowing this has all been rushed?
So I'll take a first stab at it. I will admit that I was not the first in line to get my COVID-19 vaccine. So I had some of the same concerns I think that everyone else had. And, I'm listening to the science and I want to believe the science and I want to believe it's safe, but I'm like, we've been in the medical profession, we've been burned before when, a medication goes through the trials to be approved. And, maybe there's 100,000 people in those clinical trials. And then the medication gets out and is used more widely. And now once there's 1 million people who are taking the medication, additional side effects become apparent. So there's been a number of cases where drugs have been taken off the market because it wasn't until really millions of people had taken that medication that other side effects became apparent. So I waited all the way until January to get my first my first dose. But I also did my own research and realized that the technology for these mRNA vaccines was already there. So I think that's kind of a misperception that this is this new technology and then it was really rushed through to come to market, when in reality the technology was there already. There just wasn't a market for it. There wasn't a need for it. So there wasn't a good use for it. So it was really very fortuitous for us that that work had already been done for other indications for, whether it's treating cancer, using this mRNA technology so that once the pandemic became apparent and we were able to figure out sort of the details of the virus itself in order to create a specific vaccine to protect against it, we were way ahead of the game out the gate to begin with. So it definitely, I can certainly understand it seemed rushed, but knowing more about it and knowing more about the process made me feel a lot more comfortable about how it played out. I actually worked for a pharmaceutical company for a year before I went to medical school. So, I knew a little something about, the different phases of trials and how that works. The other factor that helped get it to market faster is the pharmaceutical companies basically had a guarantee that they were going to get paid. So that's kind of another barrier. Usually it's kind of a more stepwise approach. The pharmaceutical companies invest a lot of money up front in all that research and development. And they don't know whether once that product gets to market, whether people are going to use it, how well it's going to work. But in this case, they basically got a guarantee that regardless of how effective it was, they were still going to get paid to produce it. So that allowed them to ramp up the production without worrying about having to eat that cost depending on the outcome.
Dr. Ferguson explained everything. And if you guys just give me 1 second, I have a slide that explain, is kind of a picture of everything that she shared. And I think it's useful for people to see. And it, again, this is the normal vaccine process and timeline where it can take 10 plus years. And this is what happened for the COVID-19 vaccine timelines. No step was left out. All of the same steps it's had to go through all the same steps. But as as it was explained before, some of these steps are happening at the same time in this situation, as opposed to where it just is sequential. Some were happening at the same time, but I think this is a good visualization of what Dr. Ferguson was sharing, saying.
Well, thank you for that. Before we go to the question in the chat, I would like to ask, based on what Dr. Ferguson just spoke of, what about long-term side effects from the vaccination? So anyone can, tackle that.
I can jump in. So with long-term side effects, there's a couple of reasons why we think that the long-term side effects, the risk of long-term side effects would be very low. And that's number one, like Dr. Ferguson said, this is not new because people heard of the mRNA vaccines at a particular time doesn't mean that that's when it was made. These have been studied, and like Dr. Ferguson alluded to, they've been studied for cancer treatments, Zika, Ebola. They've been studied for a long time. And through all of that studying, they haven't shown any long-term effects that came out of the blue. Point number two is that knowing the mechanism by which the mRNA vaccine works, there is very little risk or way that we could have long-term effects. Most effects of vaccines happen within the first 6 weeks. And that's why you'll see a lot of the timelines of the different phase trial. They go through these series of 6 weeks. And that's why there's a lot of issues with, waiting 6 weeks and things like that, but that's beside the point. And so because of those 2 points, there is very little risk of having long-term effects. Now, is that risk zero? No. But, in medicine, just like everything in life, it's always a balance of the risk. And if one risk is almost negligible and you have, the oncoming train of COVID that's ravaging through our community, that's something that, as in medicine, we say the benefits way outweigh the risk.
And if I could piggyback on that, I assume many of you have heard of these COVID long haulers, they're called. So these are people who have had a COVID-19 infection, and for, you know, many months afterwards, they're still having symptoms. So things like fatigue, brain fog, things like that. So again, on the one hand, we have no reason to anticipate that the vaccine will cause long-term side effects. But on the other hand, we know for a fact that there are patients who have long-term consequences after getting an infection.
And also, I would like to add, I too was hesitant to get my vaccine. I was more concerned about the side effects as well. Like Dr. Ferguson, I got mine in January, I had the Pfizer, and I did have a reaction after the second vaccine. I had a little bit low-grade fever. I had a lot of pain in my injection site. And more or less, I was just really worried. Like, am I going to grow a third ear or something? I was really concerned. But it's only lasting 24 to 48 hours. The vaccine is not going to change your genetic makeup. You know, it doesn't affect your DNA. And like what Dr. Reed was saying, you got to look at risk stratification. We know what happens when you don't get vaccinated. You end up in the hospital, sometimes on intubation machines. So yes, there's some side effects temporarily, but I do feel like the risk outweighs, or the benefits outweighs the risk.
Thank you. So we're going to go to the Q&A. I haven't done research on this, but just recently hearing much controversy about ivermectin and cover up. What do you folks think and know about this?
So ivermectin, was one of the slew of medications touted by many different outlets. And it was during a time where, we didn't know a lot about, the treatment. And so if you look online, there's a lot of treatment regimens from all over the country, and they usually include some combination of zinc, vitamin C, and then some off-label things. At one point in time, it was hydroxychloroquine. I'm sure everybody remember that, and ivermectin. And if you heard about it from where I think you heard about it, around Houston, that has been debunked. And so there is no cover up that there's a particular medication that can cure COVID-19, if that's what you're inferring. And the reason for that is there would be no need to. And so if you, A, there's no data to show it, but B, if you follow the money, who's making money on coronavirus? The people that are giving out the vaccines or making the vaccines, you're still going to need a vaccine. So if there was a cure for it, that would not change it. And all of the healthcare workers here, we can say that if there was a cure for it, we would definitely be using it. So no, there's no silver bullet magic cure that you haven't heard about. Ivermectin is not one of them.
Dr. Baldwin, did I see you wanted to respond?
No, I mean, yes, but Dr. Heat stated it all.
Okay, thank you. Next question, from your medical and clinical practitioners' perspective, how can our local government and health providers better support increased inclusion, participation in preventative community health forums and coalitions? Dr. Baldwin.
I was going to say, I can speak to this, but it was specifically to our clinicians, our practicing clinicians. So I was waiting to see if there was anything.
I think if we hear from both, from the
Okay.
perspective of the county and then also from the practitioner, I think that would be good.
Absolutely. So this has been a learning process. It really has, the pandemic and how we've responded at the public health with division as far as including different populations and groups, getting feedback from them and input, and responding to that input and feedback, and making changes to our response. And it hasn't been perfect, and so there are groups that we haven't been in touch with as much as we should, and African American and Black population is one of those. And so we're trying to, learn from that, continue, start something here and continue it long term, so that even past the pandemic, we're making the connections, we're receiving the input. Those voices are at the table, letting us know what we're missing or what we're actually doing okay. And so that is a process that we're trying to get up and running. This is one of those things. This is great, where we can make contacts and keep this going, but through advisory groups, if there's something else that's coming up, again, sending out, working through groups like yours, NAACP, other Black organizations to get that, to have that dialogue and communication. And so, that's a work in progress for us that we want to continue, that we have to continue moving forward. And so hopefully we won't have another major pandemic or, anything like this in many, many years, but whatever comes up next, we're better equipped to address the needs of all of the populations in the county.
And I like to also express, again, revisit the trust. It's sad, but it takes a watershed moment like George Floyd and Black Lives Matter for some of us in our health industry to really look at our race as saying, hey, we have a problem. It's time to wake up. The hornet nest has been kicked. So I feel as a healthcare provider, but as a Black man, I need to network. I need to get out there and pretty much find my fellow brothers. And for instance, we have a group called the 100 Black Men that's sponsoring a golf tournament within Sonoma County, which is going to be a perfect platform to express the need to get vaccinated. Also to express, hey, where are you guys? Where do you meet? Exchange numbers. So it's not just, trust in health. To me, it's just saying, hey, you guys have a spot in our community. You guys have a voice. And I don't think a lot of us know that. I think a lot of us, including myself, when I moved out to Sonoma County, yeah, it took me a while to find my voice within my Kaiser Permanente work environment. But there are, when I see an African-American patient, I light up. I mean, it's really, I feel pride. I almost feel like there's a special white unicorn that just came into this building or so, but it just gives a time, and I'm hoping that experience could show them that, hey, even Kaiser Permanente have something for you. You can trust us as well. So I do feel like we just have to get more in the community and be involved more as a person, not just as a healthcare provider.
Yes, and if there's any additional questions that may come up after this time period, feel free to reach out to our public affairs at sonomacounty.org. I think it's the email. If someone can put that in the chat, that would be great. And if there's any suggestions on how to improve that, please feel free to email and they'll get the information to us. So we have another question. Are the HBCUs that help to create the COVID-19 vaccines, are they funded by the government, White America Incorporated, or are they independent educational systems?
So I do not know the facts of how it got funded, but to me, money is green. It doesn't matter where it comes from. If it's pretty much put to the good of success and effort, that's how I look at it. HBCUs historically has been underfunded by state governments, okay? This last administration of Donald Trump just turned the key and granted all these funds for the government to help HBCUs catch up to their fellow fellow private colleges within. When I went to my school at HBCU in the mid-90s, I mean, we had still dorms that were built somewhat in the early 1930s. I mean, I was like in a time warp. It wasn't no resources. Our books, our access to like science, our access to like labs, we were at a disadvantage. So we do need to be funded, being that it's through state or local government or national government. There's no somewhat under the table deal if you get the money from the government or the man that we need to do some type of like side deal with them. I just think whatever fund it is, as long as you put it to the good, that's what it's all about. But HBCUs, we need to be funded. We need to catch up to the 21st century.
Thank you. Is a second dose really, is it really needed? Is it necessary?
I can jump in and take that one. Yes. I'm joking. I have a little bit more than that. So they did look at well, the original studies weren't powered for looking at one dose, but when they took a look back at it, they showed way superior response with the second dose. What do I mean by that? When you do a study, you usually come in with a certain hypothesis, and your study is made for that hypothesis. And for the studies for Pfizer and Moderna, the original ones, it showed that you really had 90 to 95%, between the two. So 94 to 95% efficacy, okay? Now, if you take a look at the data going backwards, there's been a lot of people trying to calculate how much protection you would get if you just got one. And so because it was not meant to look at that, we're not sure, but it looks like between 30 and 50%. Now, mind you, it's 30, 50% when we had less variants. So the question is, would you rather have some possible, protection that's somewhere between 30 to 50% maybe, and we don't know because of variants, or would you want to have 95%? And so that's why you're not considered vaccinated unless you finish the 2 shots, if you're getting the mRNA vaccines, Pfizer and Moderna. So yes, the answer is yes.
Just to follow up on that, some early, preliminary research coming out of the UK is showing that against the Delta variant, the Pfizer vaccine, because they were able to look at that. They didn't look at Moderna, but Pfizer and AstraZeneca really shows very decreased efficacy against that variant after 1 dose. But after the second dose, when you're fully vaccinated, it's good. You have there's good efficacy against that variant. And again, it's been in the news. We know it's highly transmissible. We see that happening around the world, the United States and in California. So it's another reason why, get both doses if it's a 2-dose regimen. It's important.
And if I may add, I'm sorry, go ahead, Dr. Ferguson.
You can go ahead.
All right. If I might add, based on the Delta variant, the Cleveland Clinic has reported efficacy for the second dose of Pfizer is now only 80%. Okay, when the virus first came out, Dr. Reed was saying 94 to 95%. Even if you get the second dose, when it comes to the Delta variant, 80%. Okay, that first dose, which was pretty much 80% in the past, it's only 33%. So how this virus is mutated, this is why we add a race. If it mutates, science is always at a race. And sooner or later, you're going to have viruses outsmarting the vaccine. Okay, so even the Delta variant, highly transmissible, but our vaccines are less effective already upon this variant.
Yeah, I was just going to add that was what led to the UK. They're delaying their full reopening. So, I mean, that's something that all of us want to get to. That's, if you're not going to do it for yourself, do it for your friends, your family, your community. I mean, my 85-year-old mom, who's been so isolated for the last year, she's still scared to go out, even though she's fully vaccinated. And so really all of us getting fully vaccinated as soon as possible is key to not letting these variants take root and have us ending up having to take steps backwards.
And I'm sorry, I just had to speak on this too. My mom is the same way, Dr. Ferguson. I mean, she has an airtight bubble. She doesn't even see my brother. She's kind of like under the door, what you need, I'll pass it to you, okay? But church and her faith, which we have had really hard conversations, because as in our Black community, our faith is so strong when it comes to our religion. And, her thing is, nothing could stop for me to give him praise to the Lord. And so she was going to church, but it was more outside, 6 feet apart. We said our blessings and gave kind of high five to peace with the 2 fingers. So I do feel like it's up to our ministers, up to our pastors to really be honest with our congregation of how serious this is. I mean, you talk about trust. I know a lot of us would trust our pastor, our spiritual leader in life. And so it really, we have to talk to the, our churches as well to help us with this conversation.
Thank you. How long does one need to wait to get other vaccines? So other than COVID vaccines?
You can now, the CDC has revised and the ACIP has revised their recommendations a little while ago. You can get other vaccines at the time that you receive your COVID-19 vaccine. That was not the case initially, but they've revised those recommendations. So you can get them at the same time. And really, I think your doctors are gonna, look at, are you behind on vaccinations? Is there a pro and con versus doing them all at once? There's a lot of things that can play into it, and any of the practicing clinicians here can certainly weigh in, but you can get them at the same time.
Wow, time is really flying, so I'm gonna go through and throw a power round at you. So can one get COVID vaccine if on the menstrual cycle? And then also, can someone get COVID from the vaccines? I'm sorry, can they get vaccinated while they have COVID?
So to the first question, yes, you can get the vaccine while you're on your menstrual cycle. And to the second question, it is not recommended that you get the vaccine while you have COVID. And usually the recommendations are to wait until you are asymptomatic and it's been 3 months out to get the vaccines. And that's partially because the thought is you already have the antibodies kind of circulating, at least for 3 months.
And you cannot get COVID-19 from the vaccine, was the last part of it. So it's not a live virus. There are some vaccines which contain a weakened version of the virus, and you can get some symptoms or a mild infection, but that's not the case with the COVID-19 vaccines.
And does it affect fertility or pregnancy?
No, there hasn't been any data to indicate that getting the COVID-19 vaccine affects fertility and pregnancy. But things to consider on the flip side, actually getting COVID-19 illness has shown to have some effect on pregnancies and pregnancy outcomes. So it's really, actually, when you think about it, it's pretty clear. The vaccine doesn't do that. They've not seen anything. And they have been looking at pregnant women and monitoring them that have received the vaccine, but pregnant women who have gotten the actual illness have had documented adverse pregnancy outcomes.
And can a baby be born with COVID?
Before I answer that question, and let's just kind of store that question, and I just want to ask a question too, is somewhat related to the pregnancy. What about breastfeeding? And I'm answering a question, I know I'm on the panel, but the breastfeeding has come up because I have family members that's actually are newborn moms and their hesitancy to get the COVID vaccine. Well, I have understanding, we have passive immunity that's kind of given to the newborn through breast milk. And so does any of us on this panel can kind of touch on about breastfeeding and if it's safe for females who are breastfeeding to get the vaccine and what that means to their newborn?
Yeah, you touched on it, Aaron. So the CDC doesn't have any contraindication about breastfeeding. And just like you said, there is passive immunity, which means once the mother creates those antibodies, she produces those antibodies through the milk and the child picks those up through the gut for a long period of time until they start to create antibodies themselves. a few months down the line. So it actually is would be a good thing if you can have the mother that's breastfeeding to get the shot. You're in effect vaccinating two people, one passively, one actively.
Okay, we're going to be wrapping up. Wow, time is really going. We have 10 minutes. So one of the things is with the young people. So what are your thoughts about the young people?
Can I?
Go ahead.
Go ahead. Okay. I just like to say, because I get this question a lot, and the question is usually in terms of, I don't have a lot of risk because I'm a young person. So why should I risk any symptoms at all from the vaccine to protect pretty much, people that I don't know, what have you. And so the way I always frame it is this: it's a circle of protection and not a circle the way you're thinking. So it's not about herd immunity for those people that have that particular idea. And the circle starts with you. So the vaccine protects you. And if you don't want to do it for yourself because you think, well, I'm at low risk now, then from that circle, it goes to your family and friends. And if you don't want to do it for them, then it goes to the people that are immunocompromised and at highest risk in your community. And that's the elderly and all that jazz. And I've made that argument, and still they say, well, really, maybe that's not the thing that's going to push them over the end. So the circle comes back to them, because every time a person becomes infected with the virus, so if they get infected, they may not die from it. They may not even have it. They may be asymptomatic. They may pass it on to somebody else. So every time, if they're not vaccinated, then the virus goes from them, goes to the community. It may kill some people, but if that's not enough of a reason, you're allowing it to mutate, which means it can have another crack at you. And when it comes back around, it may be a stronger variant. Okay, so it starts with you and it ends on you. So if you don't want to get vaccinated, you're going to have you may have a couple more times of stronger and stronger versions, and one of them might take you down. So that's a good way to look at it.
I agree, Dr. Reed. Like I said, I come from a big family. I have a lot of cousins that's in their 20s, and they feel, I want to go to the club. I want to get it cronking. Everybody has seen YouTube videos of these house parties in these clubs with 200, 300 people in Atlanta with no mask during a pandemic when it was at its height. And yes, you can be a carrier, you could be asymptomatic, but think about your grandmother who might have diabetes. Think about the hypertension in your family. Think about sickle cell that's somewhat prevalent in our community as well. And, with Dr. Baldwin had that statistic of the Latin community in the African-American community, just look how we live. We always going to have a third or, secondary family members in our house. That's what we do. Mothers come and stay with us when they get old. We kind of take in that, that child that maybe needs some help. Mom is not there, so maybe the brother takes the child in. We live as a village. And so if you go out there, just think about what you're bringing back to your village. If you don't, I understand, hey, I don't know that guy. Why should I be worried about it? Well, let's worry about your ones that you care about at home. So.
And to just kind of solidify what Dr. Reed was saying, and Dr. Sanders, we are seeing a increase again in cases in our younger population. It was going to happen. It's going to happen. And it started with our over 65, and they got vaccinated, and there's a high vaccination rate in Sonoma County of that population. They're not getting the cases for the most part anymore. It's gone down in age as the younger people aren't vaccinated or unvaccinated. And we're seeing it 18 to 34, even some younger kids. And in our hospitalizations, we're not seeing just 65 and plus anymore. We're moving down in age. So it's important. Nobody is, immune. Well, nobody, everybody should, that's a bad way to state it for this, but nobody's invincible. You can get COVID. And unfortunately, there is the possibility that you can have, a moderate to severe illnesses.
Okay, we have, when can we anticipate a full FDA approval?
Good question. I believe that at least Pfizer has submitted for full FDA approval. I do believe we have someone out in the meeting that's not on the panel that she might know a little bit better, Dr. Shende, but I believe Pfizer at least has gone for full FDA approval, but I don't think we expect anything before the fall at the earliest, maybe the end of the year. I wouldn't expect it over the summer. You never know.
Well, Dr. Shinde, she is on the call. If she has any information in regards to that, would she like to speak on it?
Dr. Baldwin is right on. Yeah, it looks like it will be in the fall, but not this summer. There were some reports that possibly over the next few weeks, but I don't think so. All indications seem to say sometime in the fall.
Okay, thank you for that. So, mask. Who want to start with that?
I'll give it a crack. I'm vaccinated. I still wear my mask. I have a 9-year-old who is not eligible for the vaccine. And I know, people think of kids as, oh, they have the best immune system. I'm going to give my kids chicken pox. I'm just going to give them the flu because I don't want to deal with it. I know. But at the same time, I do feel that we need to kind of always be aware that this virus could come back as well. School is going to start. And I know we did home learning and schooling, which really was, in my household, didn't work out too well. Kids need to be at school. And I'm hoping that our school will be open in the fall. But that being said, I'm not sure that our kids are going to be vaccinated. I'm not sure that FDA is going to be approved for vaccine. Pfizer's having a trial for 12 and below right now, but we need to be vigilant about our kids, especially wearing masks as they get into community. We can't say our kids who always putting their fingers in their mouths, sharing candy, they don't have any concept. So I want to stress the importance of wearing masks and contact precautions as the school year is coming up after. So it will be in August soon. So we really need to be vigilant and really teach our kids how to function in the community while being safe among their peers.
And Dr. Baldwin, what about being in public with larger events and things of that nature?
Yes, I think it's been confusing over the last month with all of the different masking guidance that came out from CDC and then California Department of Public Health, and then you throw in the Cal OSHA work guidelines and recommendations for when to wear a mask. But I agree with Dr. Sanders. I mean, I still avoid large gatherings. That's just me. I feel, it's a safe thing to do. A safer thing to do is to avoid large gatherings. I don't usually like to be crowded into places anywhere where people are right next to me and I'm bumping into them. So I guess it kind of works out for me. There's no restriction against it at this point in time. I mean, the CDC and California Department of Public Health says they don't really have any restrictions unless you get to like 5,000 people indoors or 10,000 people outdoors. And that's when they start to, recommend or require masks and things like that. If you're unvaccinated, wear a mask. Wear a mask. Wear a mask wherever you're going, whatever you're doing. I mean, I know that, indoors, outdoors, but I would recommend wearing a mask if you're unvaccinated in pretty much every situation. If you're fully vaccinated, it really is a comfort level. Yes, there's, areas where you're not required to wear a mask, but it really is your comfort level. I know many health officials who still wear their mask. They totally believe in the science, but it just is kind of they didn't get a cold this year. Their allergies aren't bothering them as much. They didn't, we didn't see much flu. So there's a lot of other reasons to keep wearing the mask. And so, they've continued. People who are, over 65 or people who have someone who's immunocompromised, so their immune system isn't quite as robust, that they live with or they interact with, even though they're fully vaccinated, they feel more comfortable wearing a mask, and there's nothing wrong with that. You can wear your mask if you want to, and do it if that makes you, feel safer and more comfortable.
Wow, thank you so much for all the information. We are out of time, but I would like to give each one of you last statements, and then we'll close out. So if anyone have anything they would like to say or share, please feel free to do that at this time. Or should I pick you? Doctor, we'll start with Dr. Ferguson.
Yes, get your vaccine. That's my closing statement.
Dr. Reed.
All right, so I know in the past, historically, there's been a lot of inequity health-wise and things like that. And a lot of times that was outside of the community control. This is one time that we do have some control to close that gap a little bit so that we don't bear the burden of increased mortality and morbidity with this disease. I'm going to echo Dr. Ferguson. I double down on it. Please get your vaccine.
Dr. Sanders.
Please get your vaccine. I want to see my brother. I want to see my uncle. I want to see my grandma. I want to see people live a long, beautiful, fruitful life. There's something wrong when somebody's 55 or 60 that just pass away, which could be preventable. So I use this platform, not just the vaccine, but preventive health, prostate exams, colon exams. You know, we all have to be aware as we get older that we need to kind of trust the medicine. You know, it's not going to be great grandma's, you know, special ointment that cures everything on aching joints. It just doesn't work like that. So please get the vaccine. If you guys have questions, ask the questions. Be careful of just picking a website and just thinking that is credible. Or, you know, somebody come with you is like, yeah, I heard they not just one chip, they have 2 chips in there. Ask them, where did you hear that from? You know, and let's just really rely upon the facts, but please get vaccinated.
Dr. Baldwin.
I don't think I can say it any better. Get vaccinated. And also feel free to reach out to the county, to the public health division, to your physicians, you know, trusted people. And if you don't trust us, at least talk to us. And we'll try to give you any information that we have to make you feel more comfortable. And we appreciate input and feedback. And we really want to hear from you. And again, what we've done good and what we need to work on. So.
Well, that is our time, and I'd like to thank you so much. And if there's additional questions, I know we didn't get to all of the questions, but if you have more questions, please feel free to email publicaffairs@sonoma-county.org, and we can try to get those answers for you. So thank you so much. Enjoy the rest of your evening.